pollution from fire-based land use kills children and adults, while the fires themselves influence biodiversity loss. And with new tools in remote sensing, modeling of atmospheric transport, and epidemiology, we can start quantifying what some of the impacts of deforestation are on human health with respect to air pollution. So this just shows you on the left-hand side what some of the deforestation hotspots are throughout Asia, and how some of these weather patterns, some of the wind patterns carry the pollution and particulates occurring after big fire events to urban areas in Malaysia. So what we want to look at is if there's any way we can make the link between deforestation in Equatorial Asia and the impacts that it has on urban populations in Malaysia, with the idea that perhaps we can establish a relationship whereby urban centers contribute to avoided deforestation in places that they're being affected, that are causing pollution. And this is just a graph to show how air pollution in Singapore increases after biomass burning in Sumatra. So those are some of the relationships we're looking at there. And the final module is looking at how marine protected areas can serve as public health initiatives in the birdhead seascape in Indonesia. And this is being led by Helen Fox and Mike Masha of WWF with a range of partners again. And one of the main reasons behind this is we know that globally reefs are at risk from climate change and from a whole range of direct anthropogenic stressors. And so what we want to do is, given the threats facing reefs, we want to, from a conservation perspective, increase conservation of coral reefs globally. They're very important for biodiversity, but they're also very important for coastal populations who depend on them for a range of ecosystem services, particularly fish production for food. So the project, the rationale behind this project is that MPAs help address overfishing and destructive fishing and provide marine resource tenure that allows communities to better manage their fish stocks. And if we can decrease overfishing and destructive fishing through good governance and good management, we can increase the fish species and enhance ecosystem integrity, and that should have a whole range of impacts eventually through this causal chain on social well-being, particularly health outcomes in terms of morbidity and nutrition. This is the sort of the conceptual model behind this project. And what we plan to do is to test NPA and non-NPA areas with respect to the health and social benefits that different reef areas provide, and also the ecological benefits that an NPA versus non-NPA area might provide. And so all of these modules come together in a broader portfolio that we hope will allow us to ask some synthetic questions about how intact ecosystems contribute to public health, and if we can create policy and potentially economic incentives to encourage conservation based on those benefits, as well as potentially other benefits and other ecosystem services that intact systems provide. So we're hoping that this collection of case studies will give us the body of evidence we need to understand how changes in nature influence changes in human health. And the main questions we're asking across all of these different case studies is, what are the costs, the economic cost of providing health outcomes through nature-based conservation? The World Health Organization recently stated that potentially maintaining intact ecosystems can be one of the most cost-effective ways to enhance human health. But we don't really know in what ways that that would be manifested. So that's what we hope some of these different modules will allow us to answer. And what we really want to know is how did these costs, the costs that are borne by, or the costs that result from ecological deterioration, compare to traditional health interventions that are designed to produce the same health outcomes in similar environments. And so to do that, we're developing common metrics that we can use to compare health outcomes across the different case studies. As you saw, the case studies are actually quite different from one another. So we want to look at dailies as a way, potentially, or we might develop other metrics, to look at how health is influenced across, health outcomes are influenced across these different case studies. And finally, we want to know what the other ecosystem services or benefits are that are provided by investments in nature conservation. So we'll be looking at co-benefits in all of these studies. And we have a long list of anticipated outcomes. We'll obviously have the 5 different case studies, and we'll be able to answer some of the questions I pose with respect to each of those modules. And we'll hopefully have decision support tools that help guide how conservation can contribute to human health in a variety of different contexts. And we'll have some general principles, obviously associated with that, that can be used by natural resource managers and policymakers who are charged with both environmental conservation but also public health. And we'll have a research framework that can be replicated to look at other dimensions of human health that we may not be addressing through HEAL. And we'll also develop statistical modeling, predictive modeling techniques that help us understand the relationship between ecological health and public health data. We're going to be we're already working with the Natural Capital Project to develop production functions that allow us to look at how the benefits provided by forests with respect to air quality are regulated in equatorial Asia. And we'll also be developing production functions for nutrition associated with the module on wildlife meat, or bushmeat, and human nutrition. And as I said, I'm presenting this on behalf of my colleague Steve Osofsky, so if you have any detailed questions, this is his email address. And to learn more about HEAL, you can go to this website that he's recently established. And that's it.
So I know we took some questions after Jean-Christophe spoke, but I'm going to ask you to actually hold them so that the other 2 presenters, including myself, have a chance to go first. So I am up next. Great. So as I mentioned when we started the session, my name is Sandeep Vala. I am a Senior Program Associate with the Environmental Change and Security Program at the Woodrow Wilson Center in Washington, D.C. The Woodrow Wilson Center is a formal memorial to our 28th President, the 28th President of the United States, and we work to bring the worlds of policy, practice, and academia together to gain a better understanding from each other. One of the projects I work on is named HELPS. It's a 5-year effort funded by the U.S. Agency for International Development to look at the intersections between health, environment, livelihoods, population, and security, and that's where the acronym HELPS comes from. So it's under that project that I'm here presenting today. So just a little information about my presentation itself. I'm going to start off with the conceptual framework to help us think through and about the specific PHE projects that we're going to be talking about. I'm going to do a quick illustration of a particular PHE project, and then I'm actually going to turn it over to Gildas, who's going to provide a much more detailed an exciting example of an effort in Madagascar, as I mentioned when I spoke in the intro. I'm then going to give the rationale behind PHE projects. Why is it that some folks think that this integrated approach is better or best, or has added value? And can PHE be an effective strategy for climate change mitigation and adaptation? Towards the end of my presentation, I'm going to talk about the foundations of these integrated development projects, and then I will conclude. So let's talk about the conceptual framework a bit. Population, health, environment, clearly three really important dimensions of well-being. And integrated population, health, environment programs, or PHE programs, work to identify the linkages between these three components. So the question is, if you're concerned about the environment, does population matter? This chart here is pulled from Population Reference Bureau's website, and you'll see that it's in modern history that we've seen the most population growth. And this population growth, this rapid population growth, is exerting pressure on natural resources and exacerbates vulnerability to climate change risks. I don't want to disclose how old I am, but I will tell you that the year I was born, world population was at 4 billion, and this past October we reached 7 billion. So the world population has more than doubled in my lifetime alone. And I'm not that old, at least I don't think. You may have heard about the UN population projections, and these are a wide range of possibilities of possible outcomes for population. By 2050, to put this in a little bit more of our lifetime perspective, the median variant takes us from the current 7 to 8 billion to 9.2 billion. And again, that's the median variant. The low variant is 8.1 billion, and the high variant is 10.6 billion. But what we don't often hear a lot about, if you have heard about these UN population projections, is that to reach that median variant, the average global fertility would need to fall below 2 children per woman. And that would require a significant extension of family planning and reproductive health efforts to the 222 million women who want to plan their families but currently don't have access to a full range of contraceptives. Actually, before I go any further with this presentation, I do just want to point out one thing, that when I'm talking about family planning, I'm talking about voluntary family planning services. We're not here talking about projects that are imposing anything on individuals. They're providing services to folks that are asking for them. If we look at this next slide, I only really put this in to give you a sense of that world population that I was talking about. If my little personal disclosure about the world population in comparison to me didn't say it enough, half of the world's population is under the age of 25. Many of them yet to enter their reproductive health years. And I will speak in a few moments about where some of the most need around, the most unmet need around contraceptives is. And you can see from this chart that it is in the less developed regions. When we talk about the relationship between population and the environment, this map says quite a bit. It's the distribution of population across the world. And the boundaries are ecological hotspots. And you can see that some of the ecologically diverse areas of the world are also experiencing population pressure. Sorry. I had an intern who tried to make my presentation pretty and complicated, is what I concluded from her efforts. So now let's talk about the connections between health and the environment. So if you're concerned about health, does the environment matter? Yes, it does. One simple example that we can look at is access to clean water. And currently 1.1 billion people across the world lack access to that. This map takes a look at the percentage of people in the world that have access to improved sanitation. The red and orange spots are where more than 30% of the population doesn't have access to improved sanitation. So that's red and orange. That's quite a few areas. And if you think back to the map I just showed you, there's quite a bit of overlap. Where there's areas of population pressure, there's often a lack of sanitation, and these often are biodiversity hotspots. So let's look at that last relationship. Concern about population, health matters. If we think about those connections, health access clearly has an obvious effect on population. It shapes life expectancy and quality of life. If we think about those last couple of maps, you'll recall that some of those areas highlighted are also areas where access to healthcare is constrained, including access to reproductive healthcare. And this is a slide that I sort of referenced earlier when I talked about the population, or half the population being under the age of 25. So you have areas of the world that have better access to healthcare, which incidentally means that they have a higher access to contraceptives, and their contraceptive prevalence rate is higher, I should say. And when we talk about access to reproductive health care, we also have to think about the other benefits that come associated with that, and that includes improved maternal and infant and child health. It also includes expanded opportunities for women, including education, employment, and social participation. So there it is. That's a conceptual framework that these projects have going into their efforts. And it was more than a decade ago that conservation and health organizations partnered to address these linkages. And recently, these projects are taking a look at whether they're effective strategies for climate change mitigation and adaptation. And they aim to simultaneously sustain natural resources and biodiversity while meeting the health and development needs of remote populations living in and around priority conservation areas. So it's these communities themselves that specifically identify a lack of access to family planning as a priority, as I said earlier. And these communities also are concerned about climate change related to women's vulnerability, reproductive health, and fertility. And while these projects work to help communities adapt to climate change, they enable community stewardship and sustainable use of climate-sensitive resources such as forests, watersheds, and coastal resources. This next slide right here is a slide of a PhD project that I got a chance to visit when I was in Ethiopia in 2010, ironically in July on World Population Day. That wasn't planned. I visited the Gypsito Project, which stands for the Gurage People's Self-Help Development Organization. It's one of the largest environmental organizations in Ethiopia and works a lot in this area around land degradation. And some of the reasons that the land is becoming degraded in that area is because of an increase in participation mixed with deforestation caused largely by a rapidly growing population. And these are all the reasons for the high levels of soil erosion. And if you'll notice in the picture that's in the top left corner, you can actually see the erosion. That's one of the reasons why I really wanted to include that slide. You'll also see the effects of the erosion on the water source in this slide in the top right-hand side. So what Gypsito is doing is working with youth groups to address this land degradation. The youth groups are provided training in resource conservation, advanced farming techniques, and soil and waste management, in addition to being provided supplies for their efforts and projects. While I was there, I had the opportunity to see one of the youth groups working by planting vetiver grass in the area, as well as fruit trees. And one quick note I didn't make earlier when I talked about the soil erosion and what it was doing to the water source is a clear example of that health and environment link that I was talking about earlier. Some of the other things, the added benefits of PhD programs, are some of the other components that they help work on. So you will see, not in a very sequential order there, but microcredit was one such example. You have capacity building occurring, which is an increased collaboration, which is enhancing local leadership capacity, as well as advocacy. I had a 3-minute clip that talked a bit about a PhD program that worked on livelihood through microcredit efforts. But in an effort to not go into the next presenter's time, I'll refrain from that. But towards the end, if folks are interested, it's just 3 minutes. I can show that then. So now I'm going to talk a little bit about the rationale Why integrate population health and environment? Does addressing these multiple needs simultaneously help increase efficiency and add value? Well, there's a lot of folks that argue that it does. From the oops, sorry about that. Oh, I messed it up. Here we go. From the conservation perspective, we know that when women are better able to manage their childbearing, they are better able to manage natural resources. So the empowerment of women should have significant environmental gains. We also hear from our environmental partners on the ground that a lot of trust is developed in the communities when they help community members address immediate community demands, including access to voluntary family planning services. From the health side, we hear from reproductive health organizations that if the conservation efforts are a way to open up the door to reproductive health and family planning for men, especially farmers. I want to draw your attention to this map and actually the video that we saw when we were getting settled in and grabbing some snacks. These were both put together, the video as well as the map, by Population Action International, an organization based in Washington, D.C. that helped with the planning of this PHE component of today's session. I have materials from their organization as well as some that I brought with me as well at the table.